Hello, this is Dr. David Green, CEO of the Florida Pain Network. Today's topic is the basics of kyphoplasty for vertebral compression fractures. Over 700,000 vertebral compression fractures occur every year in the U.S. Most of these are due to osteoporosis, and a lot of them actually go unnoticed because they're not painful. Half of women and 25% of men will actually have an osteoporotic fracture during life. And once a vertebral compression fracture occurs, the risk of additional fractures in the level above or below goes up fivefold. The symptoms may include a sudden onset of back pain that gets worse while standing or walking, limited mobility, can include height loss, deformity, and disability. If you have fractures above or below, you can start to get a little bit of a hunchback. Here's the downward spiral. You start to get spinal fractures from osteoporosis. It leads to back pain. It can lead to deformity like the hunching. It's called kyphosis. It can impinge on the lungs, so decreased lung capacity. It can impair your functional ability with walking. You can lose your appetite because it pinches on the stomach. You can start to lose sleep, decreased activity, which leads to more bone loss, more fractures, so on and so forth. And the end result is a 23% increase in mortality. What are the treatment options? Well, if it's not really that painful, you can choose benign neglect. Just kind of watch it and see how things go. Medication management may include over-the-counter pain medications such as anti-inflammatories and Tylenol, narcotics, muscle relaxers. Spinal bracing, as you see here, includes two different options. This is called a Jewett brace, which has 3 points of compression on the chest, the abdomen, and the back. There is one that encompasses the whole area. That's called a TLSO, but it's a lot more uncomfortable. The vertebroplasty procedure was invented in the 1980s for treatment of fractures due to cancer initially, and because it worked so well, it shifted in the 1990s to include osteoporotic fractures as well. It's outpatient. It's a low-risk procedure that provides instant pain relief. Now, kyphoplasty is an evolution of the vertebroplasty procedure. It was FDA cleared back in 1998. Its popularity increased tremendously 5 years later. Similar to vertebroplasty, it uses bone cement. But with the kyphoplasty, you actually put the catheter in and then place balloon first filled with saline. That creates a bony void, and then you take the balloon out, and you have a void where you slowly put the cement in. Here's how it works. You go through what's called the pedicle into the fracture. You can either do it unilateral or bilateral. You have this balloon that gets inflated with saline, and you can actually see it because it has contrast in it on an x-ray. So you can see how it creates a nice bony void. It can help get your height back that was lost. See how the height is in a wedge, and now it's more back to a rectangle. And you take the balloon out, and then you fill it up slowly with bone cement, and you can see that you get a decent volume of cement. This hardens in about 20 minutes. It's an internal splint, basically, internal cast, and it provides instant pain relief. What are the outcomes? Well, typically it's immediate pain relief. The aches and the spasms may continue for a few weeks, but most of it resolves right away. Over 90% of patients see dramatic relief immediately with increased function, including walking and performing activities of daily living. There have been some studies that showed questionable benefit. They are far outnumbered by the ones that showed incredible pain relief. The top non-operative pain management in Florida is through the Florida Pain Network. There are many clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning doctors. In the Tampa area, visit us online at painmanagementtampa.com and then call us for more information and scheduling at 813-666-4399. I'm Dr. David Green with the Florida Pain Network. Your pain stops here.